afternoon, everyone. My name is May. This is Dr. Sylvie Wellhausen. And our topic for today is going to be about upper respiratory infections. Seems like this time of year, Dr. Wellhausen, I know it doesn't look like winter right now, but we are in the winter season. It seems like the flu and the cold and the chronic bronchitis is the time when it all surfaces during this time. So I actually got a flu not too long ago, and I know you've actually withstood the winter so far. So love to get ideas on some foods, first of all, that may be more promoting of the immune system, and other foods that might not be as good in terms of immune support.
Well, when viruses are very active in the winter, it is best to increase your immune system by eating well. And the foods that are actually harmful for the immune system is actually the same foods that are harmful for most chronic disease. So we'll talk about the sugars and the dairy products. Those are the two that are difficult, and of course anything artificial, but especially sugar and dairy products. Dairy products tend to make more mucus, so when you have an infection and a virus, then you do tend to have free food for the bugs. It's like a petri dish, and they do reproduce more, and they cause more congestion. As far as the food that are actually helpful, especially, of course, it's the vegetables, but even more so, the radish family or the mustard family. They're very good for the lung and for help you breathe. And they also, the good food are good for expectorant, natural expectorant, are also the mustard family.
Okay.
And the vitamin A and the vitamin D, so you have to make sure that your blood level of vitamin A and vitamin D are adequate before the winter starts. And you can actually test both through the blood test. So, and as far as the other food, of course, you have to have enough vitamin C in your food. So all the fruits and the vegetables that are rich in vitamin C. And just also stress. You know, if you stress out, you don't sleep enough. And when you're stressed, you also don't make the right choices.
Right.
So
in terms of food.
In terms of food, you
Okay.
tend to eat more the comfort food and the junk food. So that's the problem.
Okay. So we talked a little bit about food, and then in terms of supplementation, I know a lot of patients come to you for natural ways of getting over the flu or getting over the symptoms of a cold. So what would be the difference between using a cough suppressant and what would be some natural cough suppressants versus an expectorant?
Well, first, the idea of coughing is to bring something up. So if you do not want to suppress that natural cough, because obviously you're trying to, to get rid of all those, remnants of a fight between your immune system and the bugs. So to promote that, you need to first be well hydrated. Water is very important. And you also need to take a high vitamin A. So you need to take in the form of beta carotene, so that way you don't overdose, because vitamin A can be tricky. You take a lot of beta carotene, and then make sure your vitamin D. You can take quite a high dosage of vitamin D for that 3-4 days. But again, it's best to make sure that your vitamin D was proper to start with before the winter got started, because even though in California we don't have a problem with the sun, but other states do. So that's a problem.
Okay.
And as far as the only time you want to suppress your cough is really if you just have this constant tickle that you've got nothing to spit out, but you've got this tickle that will not let you sleep.
Okay.
So that's the only time I would use a cough suppressant. And you could, try licorice or different herbs for that as well. But, if you have to, and take something over the counter. But it's best to try to use, even licorice is quite a good cough suppressant.
Okay, wonderful. And then we also get asked by a lot of the older patients about exercising during this season, or if they ever get the flu, what to do about exercise, whether to increase it, decrease it, stop altogether.
Two things. When you lay down too much, you can actually, some patients that lay down too much can actually end up with pneumonia. But on the other hand, if you really feel tired, you do not push your body. So you basically have to go with what you feel, but do not stay laying down too much. Even if you don't feel like getting up, try to be propped up a little bit. So you get a chance to have a better circulation.
Okay, okay. And then lastly, in terms of congestion, what are some differences between, people say humidifiers good, vaporizers? What is your take on kind of aiding congestion in the evenings?
The worst things for congestion is actually turning the heater in the house. So of course sometimes you have no choice, but therefore you have to compensate with some humidity. So either you use a vaporizer or you use a humidifier, depending on the temperature of the house. Like in the summer, I would suggest a humidifier, and in the winter, a vaporizer, because it's just hot steam. That is, but the heater can be pretty treacherous for congestion. It just makes you just not breathe correctly.
So having moisture in the air.
That's right.
When
And moisture in the air is, helpful. And it's the only time it's not very helpful is when you have severe asthma.
Okay.
So sometimes you'll know that if you put an asthma child, in the shower with hot steam to try to help them breathe, it might be actually the worst thing.
Okay.
So sometimes we use that to differentiate too between croup and asthma.
Sure. Interesting. Well, thank you, Dr. Wellhausen, for such wonderful knowledge. So for those of you that are interested in other topics, please give us a comment on Facebook, and we'll make sure to cover more topics in the future. Thank you so much.